It's a fraught time for the primate care team who look after Enzo's woolly monkey troop. 6-year-old Oriana is in distress. The team are fairly certain she's pregnant and close to full term. But over the last few days, they've become increasingly concerned.
She's had some very strange swelling to her vulva, which is quite a cause for concern and could be an indication of either hypertension or preeclampsia, which is obviously very serious. So the plan for this morning is we're going to bring her up to the hospital in one of the crates from the pond woolly enclosure, and once she's on the table and asleep, we're going to have a really good thorough once over, give her an ultrasound, check her blood pressure, take some blood, and potentially look at doing a caesarean, depending whether that is indicated at the moment.
The team feel they have to intervene because both Oriana and her unborn infant's life are in danger. This is her first baby, and with Monkey World being the only place with a healthy captive woolly population, every individual is precious. Local vet Dave Harding has been called in to examine the expectant mum.
We don't know for certain that she's definitely pregnant at this stage. We suspect she is. And the obvious thing is if she's not, we'll scan her, and if she's not pregnant, then we might want to be having a look at her heart or for any other signs of any problems there.
Oriana is anaesthetised in the back room to keep her stress levels down, while Saffron explains the seriousness of the situation to the worried woolly monkey team.
If there's any indication that we're looking at like preeclampsia or anything that's potentially life-threatening to her and baby, we're going to need to take it out. But we might scan her heart as well, just to make sure there's nothing going on that front.
Preeclampsia is a condition that causes high blood pressure during pregnancy. It also affects the arteries carrying blood to the placenta and is dangerous for the mother and baby. The condition has proved fatal for woolly monkeys in captivity around the globe.
Right, okay.
Once Dave is satisfied Oriana is stable, he begins his examination and confirms her pregnancy.
Yeah, it's quite a large fetus there.
Large fetus, okay.
Yeah.
She sounds a little bit gurgly as well.
The woolly monkey's breathing is giving the vet team cause for concern. They dim the lights so Dave can carry out an ultrasound to see what's going on internally.
Yeah, it's still a heartbeat there, 4.1. So, I mean, it's quite a decent size. Mm-hmm. It's well formed. Yeah, I mean, the head is right down there.
Yeah.
The baby appears healthy, but Dave spots something wrong with mum Oriana.
She's got a pleural effusion.
Which explains the breathing that we started seeing over the past 2 days.
She's got some abdominal fluid as well.
Abdominal fluid as well?
Yeah.
It's not good. Pleural effusion is water on the lungs. And there's worse to come.
She looks like she's got some heart disease here.
She has heart disease,
Yeah.
sorry.
Yeah.
So maybe pre-existing prior to baby?
I think so.
Later, the vet team have a tough decision to make and need to make it quickly before Oriana's condition gets worse. At the Parks Hospital, the lives of woolly monkey mum Oriana and her unborn baby hang in the balance.
The blood pressure has as well.
Blood pressure's dropped.
50.
Okay, thank you.
Oriana has fluid around her lungs and heart, probably caused by preeclampsia, a dangerous condition in expectant mums. Vet Dave Harding has some tough decisions to make.
I don't know whether we wake her up and give her furosemide, because I think she might die if we just...
Open her up.
If we open her up.
Dave has 2 options. Wake Oriana up to give her the drugs she needs to get rid of the fluid and allow her to give birth naturally, or remove the baby via caesarean section and then try to deal with the woolly mum's other medical problems.
Do you think she's strong enough to give birth? She's got all of these issues.
I don't know whether she's... I think we're sort of damned either way, but
yeah.
I'm only talking out aloud at the minute.
No, I understand.
Sort of, yeah.
It's a huge decision to make.
I'm happy with your judgment.
Yeah. I think we should go for it. I think we should go for it. I think so. I think we have to, because, you know, what if this is all preeclampsia? We've got to get it.
Yeah.
I think so. I think, you know, but it's very, very risky.
Okay.
The decision is made. Dave is going to deliver the baby via an emergency C-section. While he scrubs up in readiness, the vet team prepare Oriana for the operation.
Try and keep her on her front as much as possible.
Okay.
Because just help her breathing. And then we'll literally, at the last minute, we'll flip her.
Dave gets to work. A caesarean is normally straightforward, but this is no ordinary procedure.
Heart rate's up to about 130, Dave.
Okay.
The team are reassured by the sound of Oriana's heartbeat on the monitor. Minutes later, Dave lifts the tiny infant out.
Okay, who's going to take the fetus? Okay, you got. Okay.
Ruth from the primate care team wraps the baby in a blanket, massaging it to try and stimulate its breathing.
Baby breathing? Is he taking breaths? Yeah. Give him a rub. If you put your finger in to just try and clear the airway.
There is a heartbeat, but the infant is struggling to breathe.
Hayden, is there any chance you could take over just trying to revive
Yeah, that's
baby?
fine.
Thank you.
One of the vet team takes over.
Are you getting anything from baby at all? Anything?
Yeah, the heart rate's definitely increasing. So.
Great, thank you.
Dave sews Oriana up as quickly as he can. Her breathing still isn't right.
Oh, I am getting a bit of jaw tone now, Dave.
Okay, yeah, fine. Turn her up a little bit. That's fine. I mean, I'm nearly done. That's
Yeah, I'll just turn her up for a couple of seconds so she's
That's
not...
fine.
But as Dave finishes sewing up Oriana, it becomes obvious there's a problem with her baby.
It's not getting anything. I've not had any sort of response for her. Oh, I think we call it now. I'm sorry.
Yeah, no, that's fine.
It's unsurprising given how poor your mum is.
Yeah.
She
Yeah,
looks,
that's
I mean,
surprising.
you know, it's not surprising. But
It's heartbreaking for everyone. But attention must now turn to saving Oriana.
I just hope she's all right.
Yeah, no,
I mean,
that's
we've got her
my
this
main
far.
worry.
Thankfully, the woolly monkey's condition stabilises. Another ultrasound reveals that the pericardial effusion has all but disappeared.
If the fluid that she's got all relates to the pregnancy, then the hope is that the prognosis for recovery will be pretty good. It's whether there's anything more going on. So we have taken some blood tests. The blood looks quite thin, so we think she might be a little bit anemic. But we're going to get those back to the surgery ASAP and get some bloods running and see what they show.
In the meantime, Oriana will be given drugs to clear the rest of the fluid and be under close observation to monitor her progress. The team can only hope she makes it through today's ordeal. Across the park at the hospital, wildlife vet Nick Masters and the vet team are hard at work. They have a long list ahead of them, starting with Bruce the loris. He has a large mass on his face, which first appeared 3 years ago. Since then, he's had numerous tests and biopsies, but the lump keeps getting bigger.
You'd think if you didn't know better that was an abscess, wouldn't you?
The location of the mass means surgery isn't really an option, but Nick thinks he may have a very different solution: botox.
It's not experimental, you'll be pleased to hear. I wouldn't be doing it if it was, but we've got a small primate, a loris, with an enlarged salivary gland. And we know from histology, we've looked at the tissues people have previously, that this doesn't appear to be anything nasty. It just seems to be overactive and enlarged. So we're gonna find the sort of centre of this enlarged salivary gland in Bruce, and I'm gonna very carefully inject a small dose of botox into it, and we're gonna see over the subsequent days what happens.
Nick has previously used the treatment successfully on a spider monkey with a blocked salivary gland. The idea is to paralyse part of the gland to stop it constantly filling with fluid. But the procedure isn't without risk.
I just want it to go into the tissue that we want it to affect rather than a muscle and cause paralysis to the side of his face, for example.
Nick uses a portable ultrasound to find the safest location to insert the needle.
That's good, that's great. And I'm just going to clean below that, and then I can inject using that as a guide.
Because loris are so small, only a tiny amount of botox is needed.
Tough skin.
The procedure is quick. But seeing if it brings any beneficial effect will be a waiting game.
So I think at the moment it looks like he's completely in control. He's got no kind of central neurological problems, so he knows exactly where he is. But yeah, the physical bulk of that will be pulling his head over slightly, which he'll have to be compensating for all the time. So hopefully what we've managed to do today is, get it to contract back down a little bit. But we'll see over the coming weeks, I think.
With Bruce on his way back to the loris complex to recover, another primate is en route to the hospital. Charlie is one of the park's much-loved stump-tailed macaques. She arrived along with 9 others from a medical research laboratory in Scotland 11 years ago. The majority had a variety of health issues. Charlie's was a displaced hip, causing her serious mobility issues. In recent weeks, her condition has deteriorated, and Nick wants to find out why. He goes straight to the root of the problem.
Oh, so she's got amazing crepitus in this knee. That sort of scrunches away when you move it. And she's got a very limited range of movement in the hip. She can't abduct at all. Okay. Shall we get the X-ray? Let's put her back in lateral where she's more comfortable. We'll get the plate set up and then we'll move her into it just at the last minute. I'll deal with her. You sort the X-ray out.
An X-ray of Charlie's joints is the only way to reveal how serious her condition is. The results are shocking.
My main concern is not the hips, it's the knees. So, all of this is new bone growth. It's messing up the space. You can see it's horrible, absolutely horrible. I mean, we can't see what's going on with the cartilage, but I think probably those surfaces are completely shot as well. So I think we've got to the point where we're, it's palliative care, really. So probably time to make a decision, I think.
Charlie is already on pain relief. Nick isn't convinced her pain can be managed any further to give her the quality of life she deserves.
I think it's time to call it a day. Yeah.
It's a devastating but not unexpected blow for the team.
Decide
But
not
this
to
is
put the
never
script
going to
today.
get better
No, it's
or
not.
whatever. And
No, definitely not.
oh, such a shame. She's the second youngest, but
Definitely the right thing to do, in my opinion. Yeah, not gonna fix that.
Everyone's agreed. It's time to let Charlie go. It's a sad end to a long day for the vet team and primate care staff. Over the last few weeks, the primate care team have become increasingly concerned about one of the chimps at the bachelor group. Gypsy is 27, relatively young for a chimp, and generally happy, although he has had a medical condition that the team are aware of. Recently, however, he's developed a persistent cough, causing him to be out of breath after activity. The team have called in wildlife vet Nick Masters to check him over under anaesthetic, in the hope of ruling out anything serious.
So he's new to me. Saffron showed me some photos of how he gets these little, what we call sort of petechial hemorrhages, sort of on his tongue and his lips sometimes where he bleeds. Been tested for COVID already, but we'll repeat that actually, I think is the plan, because we'll be able to take swabs really, carefully, scrupulously this way with Gypsy asleep. Chest x-rays, general MOT, bloods, etc.
Gypsy was hand-reared at a zoo in Israel and arrived at Monkey World in 1996 along with 3 other young chimps who'd been smuggled from the wild: Hananya, Tico and Shamak. They grew up in the nursery before moving to what was Rodney's group and is now Hananya's. When Gypsy became disruptive, he was moved to the Bachelors, where he's now settled and well-liked. the team don't want to put Gypsy under for too long and have opted to use mobile investigative equipment, which can be set up in one of the bedrooms at the bachelor house.
We've got portable X-ray kit that we'll take down there. So that means we can do the anaesthesia just as safely. It's a little bit more clunky, but we can take the X-rays down there rather than use the machine that's set up here. So it's safer. We don't need to extend the anaesthesia for as long because we don't have the journey time to get here and back again. We're minimising risk to people. And by reducing the anaesthetic time, we're minimising risk to the animal as well. So lots of good reasons to do it there.
Whenever possible, the team prefer to administer anaesthetic by hand injection. But today, Gypsy is not playing ball. Despite having a pre-med to make him drowsy, the chimp isn't letting Sean anywhere near him.
As soon as I got the needle out my pouch, he just shot straight up, and he's too awake now.
Not going to happen.
So
Okay.
I think we're going to hand it.
Can I have a look at where he is so I can see
Yeah, of
in
course you
terms
can.
of darting how hard it's going to be?
They're going to have to resort to Plan B, using a dart, which is more stressful for all concerned.
We're not going to be able to hand inject him, so I'm just going to put what was in this syringe to be hand injected into a dart instead. Anyone coming with me, or I'm going on my own? Oh, it doesn't bother me either way. Come on. Make sure I've got the right chimp.
You're all right.
Darting an agitated chimp is never easy, and as Nick isn't a regular face for Gypsy, it's even more tricky. A high level of expertise is required to get it right. Sean and Jeremy distract him while Nick takes the shot. The anaesthetic dart hits the spot first time. It should take effect within minutes.
And we know it's gone off properly because the cuffs come all the way back, so it's been in his muscle, he's got the drug, and he's destroyed my needle. It's a brief period of stress for an important procedure, that's how I see it.
While Nick prepares the rest of his portable equipment, the team keep an eye on Gypsy.
His eyes are still open, but he's flat out. Yeah.
Okay, he's flat down.
Is he? Great.
The anaesthetic is doing its job, and the team can crack on with theirs.
Ready?
Gypsy is moved into a bedroom that's been converted into a temporary examination room. It's a tight squeeze, and the vet team will need to work quickly to try to discover the cause of Gypsy's problems. In one of the bedrooms at the chimp pavilions, wildlife vet Nick Masters is about to give 27-year-old Gypsy a thorough health check.
Nicely down, isn't he now?
The chimpanzee has been anaesthetised, and to keep the procedure as short as possible, a temporary examination room has been set up, along with portable X-ray and ultrasound equipment.
His saturation is high 80s at the moment. His heart rate's 75, so that's okay.
Gypsy has been suffering from a persistent cough and has been losing condition. A recent test for COVID came back negative, but the team were concerned enough to ask Nick to examine him. The first thing he does is take blood samples, which will be sent to a laboratory for analysis.
That sample, lovely, thank you. Just gonna have a little good listen to his chest. Okay, all sounds okay. I think let's try and get these X-rays, shall we?
A chest X-ray may shed some light on what's causing Gypsy's cough and poor condition, both worrying symptoms.
Yeah, gonna have to lift him on. That's it, good, well done.
Taking an X-ray in cramped conditions isn't straightforward.
Is this table gonna be strong enough for me to stand on it? It should be, shouldn't it? Let's try it, let's try it. If I was to stand and hold, yeah, that'll work, wouldn't it? Let's do that.
It's a bit of a balancing act, but Nick and vet nurse Saffron managed to take a number of X-rays of Gypsy's chest.
Okay, let's try that. Yeah, happy?
That's a chest.
That's a chest. That is concerning. No, that doesn't look very nice at all, does it? Okay.
The results are worrying.
We should have a nice cardiac silhouette here, but instead we've got this very mottled appearance. It's not normal, and I worry that he's got either some sort of pneumonia or masses in his chest.
An ultrasound may provide more information.
This is not normal.
No.
It's definitely not normal, and it's not gut. It's either liver or spleen.
It's not the kind of news the primate care team were hoping for.
Is that something that could be corrected surgically?
Not sure. It looks like a sort of grossly abnormal organ to me.
Right.
Certainly not. He's eating all right, is he?
On the stuff he likes, he will eat a lot of, and he does get a lot of extras as well, like peanut butter porridge,
Yeah.
plenty of fruit, but yeah. Oh, yeah, yeah.
Okay, I think we're probably running out of things to do here. No free fluid around the lungs. Liver, diaphragm all displaced very high. Liver architecture actually looks normal. Spleen, that looks grossly abnormal to me. And I would worry about some sort of growth or changes there. Okay, I think we're probably going to stop there because we've probably learnt as much as we can.
There's nothing more Nick can do at this stage. The team carefully move Gypsy into a nearby bedroom to recover from the anaesthetic. As they wait anxiously for him to come round, Nick gives the team a summary of what he's found.
His whole thorax is quite small. His abdominal organs are all sort of pushing right up into the diaphragm. It might be normal chimp anatomy, but it's not sort of familiar to me.
Yeah.
And it looks like he's got a big spleen. I'm a bit worried about that. So we'll get the blood results, but I think there's something fairly serious going on, I'm afraid. Something systemic.
Then, as Gypsy begins to wake up, he starts to display difficulty breathing.
Gagging on your tongue, aren't you, silly boy?
There's only one way to clear his airway, but going into a confined space with an adult chimp is dangerous, particularly if Gypsy should recover.
Bring me some gloves, please, Sophie. That'll do, yeah, one of those.
With the chimp's condition deteriorating fast, Jeremy and Nick have no option if they're going to save him.
Very careful what he's going to do. Good boy, good boy.
Gypsy has swallowed his tongue. Nick attempts to free it while Jeremy keeps watch.
Come on, bring it down. Okay, it can actually move air now.
Success. Gypsy's airway is freed and he can start to breathe normally. After a few minutes, he begins to come round.
Oh, is nothing ever simple with you? Eh?
The team will keep a very close eye on the chimp's recovery while they wait for Nick to check the x-rays and ultrasound in more detail. But they'll need to wait for the blood test results to come back before any decisions are made about Gypsy's future. It's been just over a week since Alison took in a red-bellied tamarind abandoned by its owner and rescued by the RSPCA. The small primate is the only one of its kind at the park. The team have named her Red, and she's settling in well to her new life at Monkey World.
Her personality has really been shining through. I think she was just really lonely because whenever we come over to give her attention or to give her some food, she's straight over. She loves a chat, and she's not doing it in sort of a worried way or a concerned way at all. She just comes over and starts chatting to you because I think she's so starved for company. And yeah, she's just a pretty confident little lady. She loves her insects, absolutely loves them, particularly crickets. When I first brought one of those out to show her, she was so excited. But yeah, she's a really nice, chilled out little girl and very, very sociable character.
Red had been abandoned in a cage at a rented flat in Wales. The RSPCA, called in by the property's landlord, contacted Alison for help. The tamarind didn't have a good diet, little water, and had a swollen stomach. When she arrived at the park, the care team noticed her feces contained large amounts of sawdust and she was continuously drinking, which raised alarm bells.
She does still drink a little bit more than everybody else does on average, but that can also be a learned behaviour out of boredom and hopefully not a diet thing, because now that she's getting the proper diet, the drinking has become much more stable. Her stomach looks a lot less sort of hard and bloated now. So I think it's mostly, touch wood, sorted itself out.
But before any further decisions are made about Red's future, she needs a health check. Local vet Dave Harding has arrived to carry out Red's medical examination. If she gets the all clear, the team will start thinking about where she can be housed and finding her some company. vital for all primates. Red is put under with gas, using a specially constructed anaesthetic box for small primates. Dave examines her abdomen, looking for any signs of bloating.
It feels okay. I mean, it feels like there's a fair bit of food in there, but it's not. It's nothing terribly hard or worrying.
A relief for the team. Next, he checks her teeth.
Just looks like there's a slight chip on the right canine.
The tamarind's molars are worn down and stained, a sign of her age. She isn't a youngster. Dave examines her back legs and has concerns.
That left seems to extend quite nicely, and the right seems to get so far, and then I wonder what the position of that patella is, actually, because it does look abnormal. Right, should we get some x-rays next, then? Yeah. Okay.
The pictures should help Dave understand what's causing the mobility issue with Red's right leg.
Okay. That's interesting. Now, the x-rays show that she's, at some stage we suspect that there's been some sort of traumatic incident that's just slightly dislocated her knee, so it can't extend properly. So everything is now set in that position, so short of sort of major reconstructive surgery, which is not terribly practical, it might be something she has to live with. So it may be that giving her painkillers might just help her use that leg a bit more. We'll just have to see, really.
It's worrying for her future healthcare, but something the team can probably manage with medication and by adapting the branching in Red's living areas to make it easier for her to move around. The tamarin is returned to the house to recover. When the blood results come back, the care team can begin to plan the next stage of Red's future and consider who might make a suitable companion. It's been 2.5 months since woolly monkey Oriana had to have an emergency caesarean section. It was a traumatic and sad day for everyone. Oriana survived the ordeal, but sadly, her baby did not. During the procedure, the team grew concerned as they discovered a number of worrying issues. It was hard to determine if they were purely pregnancy-related or if the woolly monkey had other underlying health problems. Oriana needed time to recover from the C-section and anaesthetic before any further investigations could take place. Now, the vet team have decided to take another look at her.
We had a situation where she had fluid around her heart, she had fluid around her lungs, she had fluid in her tummy, she was very late pregnant, she was a very, very sick animal. And the question is, has Oriana got pre-existing high blood pressure, which is the strong suspicion? It is just a case of looking for as much supportive evidence as you can, as well as trying to get a rough idea of what the blood pressure is.
Oriana isn't the only female woolly the vet team will examine today. Her half-sister Olivia, who lives in Laval's troop, is pregnant. The team want to make sure she isn't suffering from the same conditions experienced by her sister. But first up is Oriana, who's been sedated in her house and brought over to the park's hospital.
Happy?
Yep.
The team need to work quickly. Wildlife vet and anaesthetist Nick Masters intubates her while concerned staff watch on.
Okay, that is now in.
Sounds good.
Good girl, good girl.
Once Oriana is stable, local vet Dave Harding prepares to perform an ultrasound to check her heart.
Light on, that's great. Okay.
Straight away, he spots something abnormal.
So it looks like sort of quite a big left atrium. That's usually suggestive that there is significant heart disease.
Nick monitors Oriana's blood pressure throughout.
According to this, she's 87/36. No effusion, Dave?
Certainly nothing
Nothing grossly obvious, yeah.
There's no sign of the pericardial effusion or fluid around the heart the female woolly suffered during pregnancy. But her blood pressure isn't what they expected.
Actually, her pressures are low, if anything. And in the past, I've done this on woolly monkeys, even under anaesthesia, their pressures are really high, so something slightly different going on here. So what's your plan, Dave?
I'm just checking that all the fluid's gone, and I'm just trying to get some measurements of her kidney size and her kidney appearance, just for reference, really.
Dave completes his ultrasound checks. Next, the vet team want to take a series of X-rays of Oriana's chest, which they will compare later with her sister's. Once they're complete, Nick begins to bring Oriana round. As he does, her blood pressure rises dramatically.
177 over 112.
It could be affected by the anaesthesia. Nick tries to get a more accurate reading.
193 over 100.
OK, yeah, stop. I think we'll put it back now.
Yeah. Okay. It's definitely above what we think is normal. So there is, we're sure, a cardiovascular blood pressure problem going on for her, which would have contributed to the problems with pregnancy.
It's a huge worry. But today's examination has provided a lot of useful information about Oriana's condition.
2 of her heart chambers, what are called her right and left atrium, are enlarged, and that suggests that she has got some significant heart disease, and will probably be something that we'll need to manage going forward.
Oriana recovers in her travel crate, ready to be returned to the house. Her half-sister Olivia is next on the vet team's list, and her health check could provide vital comparisons for the team on how to treat this complex species. It's a busy day for the woolly monkey team. Female Oriana has been returned to her house and is being monitored as she recovers from a health check under anaesthetic, while her 5-year-old half-sister Olivia is en route for her examination. The team are confident she's pregnant, but less sure about when she's due to give birth. This will be her first baby. And concerned following her sister's experience, the care staff are determined to make sure Olivia's pregnancy runs smoothly.
Bearing in mind that there possibly is some genetic issues with woolies that's linked to their high blood pressure, we're just a bit worried that if she's pregnant, she may be going a similar way. So it would be better to try and assess whether she is pregnant now, and then potentially we can try and do something about it to try and sustain the pregnancy.
A quick inspection confirms the team's suspicions.
Oh, yes.
Yeah?
I think so. I think so.
Yeah. Yeah.
Sharon, she is pregnant. Yeah.
While Nick intubates Olivia and makes sure she's stable, Dave prepares the ultrasound.
OK. Yeah, all right.
First, he examines the fetus.
Okay, that's
Look at that. How cool is that? Look at this little heart going.
OK, so head is down. That's a sort of head diameter. That's 20, 29, 30, that's 3 centimetres pretty much.
Halfway through.
It's good news. Olivia's baby is healthy and developing well. She's more than halfway through her pregnancy. Dave moves on to checking Olivia's heart.
You see that, Nick? That's the aorta, and that's the left atrium there.
Yeah,
you see the difference?
What a difference, yeah.
All right.
Looks like no pericardial...
There's no pericardial effusion, yeah.
Olivia is not displaying any of the symptoms that affected Oriana so traumatically.
So, we're going to try and get some blood pressure measurements for comparison to... Oriana's a half-sister, is that right?
Yeah, they share a father.
Nick wants blood pressure readings he can use to compare with Oriana's stats during anaesthesia.
There you go. So she's down at 74 over 28. It's low, much lower than we would expect if she was wide awake. Don't have enough knowledge to know how it compares, so it's unusual for us to anaesthetise non-human primates with this combination of drugs, or even with the ones we would more usually use, and immediately measure their blood pressure. So because they're a particular case, we're just making the effort to get our blood pressures on them straight away. But yeah, it's definitely low.
Dave checks the rest of the woolly's vital organs.
That's the thing obvious us to look at. Yeah, no, that's good.
Olivia appears in good health.
Baby looks fine. Heart seems pretty stable. It's in a good position. Seems to be relatively well developed. Her head is about 31 millimetres in diameter. So we're you know, sort of 3/4 of the way, probably, as a rough estimate.
The team takes some chest x-rays to compare with Oriana's.
That heart looks more
normal.
Well, it looks, I mean, if you compare the two.
Yeah, absolutely. And there's none of this.
You compare that
to
that.
Yeah.
You know, there's more of a left atrial waste there, called cardiac waste.
Wow, that's excellent to have. What a difference.
It's good, isn't it?
Yeah, really good.
A final blood pressure reading just before she comes round.
117. So it's not doing what Oriana did.
It's a lower and more normal reading than her half-sister, which is great news for Olivia, but raises concerns for Oriana. Olivia appears to be a fit and healthy expectant mum. It's been almost a month since wildlife vet Nick Masters visited the park to examine Gypsy. Since then, the bachelor chimp's blood test results have come back as normal, and a COVID test proved negative. It means there's still no obvious explanation for the abnormalities, which showed up in x-rays of the chimp's lungs. In the weeks since, Gypsy's condition hasn't improved. In fact, he appears to have deteriorated. Now, Nick and the vet team are going to have a second look.
His breathing has become very shallow and rapid, which has made us quite suspicious that there's something else going on other than the chronic bronchial patterning that we saw in his lungs. He has also looked to lose some weight, and he's not quite behaving like his normal rambunctious self, which is very unusual for him. So we are quite worried about him at the moment, which means we want to have him down just for some further investigations, just to make sure that we're not missing anything and to make sure that we're treating him the best we possibly can.
The day hasn't got off to the best of starts. Gypsy refused his pre-med and wouldn't cooperate when a member of the primate care team tried to administer the anaesthetic by hand injection. Nick has had to resort to Plan B and dart the chimp.
We're just trying to minimise all that pre-anaesthetic stress if we can. Doesn't help physiologically, but we've done it now, and fingers crossed he'll be going down.
Gypsy is taken straight to the park's hospital, where he's intubated and stabilised. Local vet Ruth Crossman is assisting Nick and will perform an ultrasound.
So previously we took chest x-rays, but under quite difficult conditions in the enclosure. So it'd be good to repeat those. But you're all set up and ready to go, aren't you, with the scan?
You can do the chest, I don't mind which.
Oh, OK.
Do you want to do x-rays first?
Let's get the x-rays done first.
Nick wants to do a number of x-rays to compare to the ones taken last month. He's looking for changes around Gypsy's vital organs, and his lungs in particular.
Does this look generally quite radio opaque to you? I mean, we're not low on the settings, are we? So we're not really getting to see vessels coming from the heart or anything, are we? So he's got major changes in the lungs. It looks as if there's a sort of thickening of the walls of the airways and maybe some of the tissue between them. It's the sort of picture you see in people that have like a chronic bronchitis. What on earth has caused that? We don't know. We're speculating completely. So we're trying to treat him symptomatically at the moment.
Heart rate has come down a little bit as well. 72 is what I was getting.
An ultrasound should provide a clearer picture. Gypsy's heart appears normal.
I think the left atrium that's quite a nice one, the left atrium there, it doesn't look huge compared to the left ventricle.
Yeah.
And they seem to be closing all right there.
Yeah, absolutely.
As does his spleen.
Looks functionally normal, yeah? Yeah.
That leaves his lungs. The team decide to perform a tracheal wash. A second tube is inserted down Gypsy's throat and a saline solution injected into the lungs before being drawn back out.
We're just trying to get a sample of any sort of cells or bacteria that are present in the lung and to look to see whether that is normal or not. It's very clear, doesn't it? Yeah, that's good. That's good. I mean, it fits with his very dry, unproductive cough.
It's reassuring, but still doesn't get to the bottom of Gypsy's condition. A new set of blood samples is taken for comparison. Then Gypsy is put on the scales.
50.2.
So his weight today was 46.2, so he's lost 3 kilos in 3 weeks.
It's as good as we can do. No, I think that's as good as we can do, definitely. I'm sure we know, where the problem is.
Yeah.
We don't know exactly what the cause is.
Gypsy is returned to one of the bedrooms at the bachelor house to recover. The team still don't have a definitive answer, but hope a course of medication will see him improve. But a few days later, their optimism was dashed. Due to a long-term health condition, Gypsy had also developed the autoimmune condition Crohn's disease, and nothing further could be done. The terrible but important decision was made to let him go. The team will miss him.
Just devastating to lose him. Just getting food into him became a bit of a nightmare. He just had no desire to eat, and we were looking at this very emaciated chimpanzee, and he needed food to get through it, and he just didn't want to do it. He was just losing the world, we think. There was an awful lot wrong with Gypsy, so as heartbreaking as it was for us, it was absolutely the right decision, because we just wouldn't have got him through it, and he was quite clearly suffering. So yeah, just a horrible, horrible time for everyone involved, really.